Hello everyone, I'm Anthony D'Souza and welcome to this series of videos on the exciting world of healthcare science.
Hi, my name's Emily. I currently work in the Visual Electrophysiology clinic here at Gush in the Ophthalmology department. I'm just finishing my STP, which is Scientist Training Programme, and that trains me to be a clinical scientist here. We test the visual pathways, so we look at the retina, the back of the eye, the optic nerve and the visual cortex, which is the vision part of the brain. Patients get referred here from ophthalmologists, either internal at Gush or external from other hospitals, and usually the referrals will be because the patients have a declining in vision or they want us to look at the visual potential of a child. So a lot of children, they can't tell us exactly what they can see, so our tests help to determine a visual potential of these kids. We're guided by the patient, so all of our tests are adapted for children, and we always talk to the patient and the parents all the way through to see exactly what we can do to mostly benefit the patient and also answer the clinical question. So I completed an undergrad degree in biomedical science, and then after I graduated I enrolled in the Scientist Training Programme, the STP, in Ophthalmic and Vision Science, and there's lots of different STPs from like genomics to cardiac science. We see all ages of patients, reflecting the demographic of people coming to Gush. So from premature babies up to teenagers, we see and adapt our tests to all of these patients. In the clinic we mostly do two different procedures. So we do a visual evoked potential, or called a VEP, and an ERG, electroretinogram. So the VEP uses sensors over the back of the head, over the vision part of the brain, and looks at messages going from the eye to the brain, either to some patterns on the telly or some flashing lights. The ERG looks at the back of the eye, the retina. What we do is we look at different cells in the retina using different coloured flashing lights in the dark and in the light.
Hiya, I'm Sybil. I'm going to be sitting in for a patient today so that Emily can show us how the OCT works.
We ask the patient to place their chin on the chin rest and their forehead against here. And then we ask them just to look at blue light in here. And it doesn't hurt, all they need to do is look. And we come close and you can see the retinal scan here and next to the back of the eye. And then we're just going to do a few scans over the macula, which is responsible for the central vision. And then we're also going to move the light to the side and look at the optic nerve. We look at the optic nerve as our standard procedure. The optic nerve goes from the eye to the brain, and so optic nerve head scans can be used to assess that visual pathway. So we're going to show you the visual evoked potential, which looks at the messages from the eye to the brain, and also the ERG, the electroretinogram, which looks at the back of the eye, the retina, and how we test these in babies. Once the patient is seated in the chair, we pop some sensors around the eyes and also over the back of the head, over the vision part of the brain. These sensors are held by a cream that washes out at the end and is mainly made of salt, so it doesn't hurt the patient at all. And we record a visual evoked potential and an electroretinogram at the same time. So first we show some squares on the telly to the patient, and this is looking at the visual evoked potential. We distract with a cartoon or with nursery rhymes, and we get the child to look at the telly while the squares are showing. And we record signals that are going from the eye to the brain. We look to see how big those signals are and also how fast they are, and we compare to reference range data. The second part of the test, we show the patient a flashing light. Using those sensors that are near the eyes, we can look at the back of the eye, the retina, and this is the electroretinogram. Firstly, we'll do some flashes in the dark, and this mostly looks at the cells called the rods in the retina. And then we'll do some flashes in the light with the lights on, and this looks at the cones in the retina. Our tests are non-invasive, and we make sure that the patient is comfortable throughout. As you can see, this patient is very happy and has been distracted by toys and music and leaves the clinic room hopefully feeling like they've just watched telly with their mum.